In this video, we will discuss Austinflint, Grahamsteel and Carey Coomb Murmur. We will also compare these murmurs. So, Grahamsteel Murmur. Grahamsteel Murmur is heard in the left second intercostal space and it radiates down the sternum. The murmur is difficult to differentiate from the murmur of the aortic regurgitation, which is heard in the left third intercostal space. Both of them are diastolic. So, Grahamsteel Murmur is a high-pitched decrescendo diastolic blowing murmur in the second left intercostal space that radiates down the left sternal border. As I already told, is difficult to differentiate from the murmur of the aortic regurgitation, which is in the third intercostal space. The Grahamsteel murmur is diastolic and is from the pulmonary regurgitation. So it's a right-sided murmur which increases on inspiration, whereas aortic regurgitation murmur is a left-sided murmur, so it does not increase on inspiration. It increases on hand grip exercise. Grahamsteel murmur increases with inspiration, and the other features are hyperdynamic right ventricle, right-sided S3, and wide splitting of the second heart sound. The other conditions that cause wide splitting of the second heart sound are right bundle branch block, pulmonary stenosis, pulmonary embolism, mitral regurgitation, and left ventricular ectopic beat and the pacemaker. So what's the cause of Grahamsteel murmur? Pulmonary regurgitation occurs secondary to pulmonic valve ring dilatation due to severe pulmonary hypertension. So severe pulmonary hypertension leading to pulmonary valve ring dilatation that causes pulmonary regurgitation and a Grahamsteel murmur. Now the next is Austinflint murmur. Austinflint murmur is a rumbling mid-diastolic murmur heard in the aortic regurgitation due to the displacement of the anterior mitral leaflet by the aortic regurgitation. This is the aortic regurgitation area, a blowing diastolic murmur in the left third intercostal space in aortic regurgitation. In this condition, the blood enters the left ventricle simultaneously from both the aorta and left atrium because of displacement of the anterior mitral valve leaflet. So how do you differentiate this murmur, which is diastolic, with the murmur of the mitral stenosis? There is absent opening snap and the first sound is not accentuated. Now the Carey Coomb Murmur. It's a mid-diastolic apical murmur due to inflammation of the mitral valve leaflet in acute rheumatic fever. It's due to increased blood flow through the mitral valve. Murmur may be associated with S3 gallop rhythm. So Carey Coomb Murmur on the apex due to mitral valve leaflet inflammation in acute rheumatic fever. Murmur disappears when inflammation subsides. How do you differentiate Carey Coomb murmur with mitral stenosis murmur? There is absent opening snap, normal or muffled S1, and no thrill in Carey Coomb murmur.